So this treatment technique is for a bilateral loss of flexion on a pretty irritable patient, moderately to severely irritable, and you've chosen to begin a mobilization process using manual therapy. Your first option likely is to keep the spine in relative neutral and keep your grades on the lower side. So if we're at the 4 level, I'm probably going to start with a longer lever technique, hoping to stabilize them, gauging how much we can take him. Miles is pretty tight, so he engages at about 80 degrees here. So a longer lever technique. Now I could choose to take the next progression. I need you a little bit closer now. Again, still keeping him in neutral, but now creating a shorter lever. So gauging, motion, and here I'm kind of going from the beginning of range to the end. So I'm not even in many ways grading it. I'm just sort of going through 1, 2, 3, 4, 4, 3, 2, 1 in that whole cycle of what we have. I could ask the client to create some sort of active contraction. So Miles, keep your pelvis right there. I'm going to try to push it towards me, stop me from pushing it forward. Really light, so about a 20% contraction that you have available. So hold your pelvis there, don't let me take it back. Ask the client how they feel, if they tolerate that well. Relax, hold it 5, 7, 10 seconds. Hold again. Relax, run through that at least 3 times, and then you will find that your barrier softens. You're going to take up that range. Do that again, Miles. Relax. Do that a few times. The barrier softens, taking him to what would probably now be R2, and then you're going to mobilize maybe with a shorter lever. Okay, so now you could begin the process of using some physiological locks. So I probably would start with a upper lock, so I place the patient in a degree of flexion. I need to pull you towards me a little bit. Good. Here we can still keep Miles as pretty, because he's pretty stiff, I can get away with the setup this way. And then coming in with this same type of process, gauging it, using active mobilization from a physiologically flexed position above, grading it appropriately to his problem. If now I choose to physiologically lock from below, I'm going to need to ask him to extend his leg, probably keep him degrees of flexion, keeping him a degree of flexion. I could probably use that top leg to help me in the mobilization process, because I'm going to use my hip to create a flexion moment. Stabilize. We've flexed his top half. We've flexed his bottom half. Same process. Active mobilization, graded mobilization. Here I could ask Miles to sort of try to extend his leg and relax. Do that a few times and relax, and then gauge up more flexion through here, and then impulse the flexion moment in this direction. The next progression we might get away with is now doing the traditional locks using a contralateral, ipsilateral setup. I'll get you closer towards me, Miles. So here we're going to create a contralateral setup in the traditional sense towards flexion. Straighten out the bottom leg, keep him in that sort of flexed position. And now we're going to assume that he's going to tolerate a longitudinal force. Specific traction is really what this traditionally would be called. So we've created we'll still describe this as relatively from a neutral position. So here we are going to create a specific traction. If Terry can home in on my fingers, we can see that I'm being fairly specific to that segment. The next progression now would be to build a barrier of flexion and do traction with that. So I'm at the segmental level. I'm going to build bilateral flexion into the system, and now I'm going to do specific traction in flexion. Using active mobilization if you choose.